Welcome everyone, my name is Huie Lin. Welcome to our second monthly Adult Congenital Heart Disease DEBAKEY CV Live. This is a brand new event that we're doing every month, and our focus is to use our patients as educators because we believe that our patients have so much to teach all of us, not only healthcare providers, but other patients as well. This is going to be happening every second Wednesday of the month at 5 p.m. Our next event is going to be December 9th, 5 p.m. Central Time. Contact us if you'd like to be involved. This is a specific shout out to you, Zipper Sisters, because we want to get you involved. If you're interested, we just had our first episode last week in which Ms. Tina Daigle told us about her journey from being a transposition of the great arteries patient to her life after heart transplantation. So without further ado, let's get into today's session in which we're going to be talking about how we are stronger together, building a community around congenital heart disease. So to my left here is Dr. Tom McGillivray. He's the Chief of Cardiac Surgery and Thoracic Transplant here at Houston Methodist. To my right is Joe Valente. I want to automatically call him Uncle Joe because that's the name of his organization. I'm just going to briefly mention things because I really want to have everybody hear the stories from our speakers themselves. And then, of course, with us online is Anna Jaworski from Heart to Heart with Anna, the podcast centering on congenital heart disease. And then finally, Eric Ankerud from Heartfelt Dreams Foundation. And we're going to learn a little bit more about each of them now. So Eric, would you mind telling us a little bit about how you got into congenital heart disease in the first place? And what's the mission of your foundation?
Well, thank you very much, Dr. Lin. I very much appreciate the opportunity to participate in your very important program. The Heartfelt Dreams Foundation was started about a year and a half ago based upon the experience that my wife has brought to the table. My wife was born in the late 1950s with a congenital heart defect called tetralogy of Fallot. She was fortunate enough to have had infant surgery at a time when open heart surgery was evolving. And she was in a place and a time where there were some pioneering cardiologists in pediatric care. She had the surgery, survived, and has been thriving ever since. We were fortunate enough then through my career to be introduced to a cardiologist at Massachusetts General Hospital who was expert in I have to mute my phone here. Sorry about that. Sorry about that.
No problem.
She had been referred to a cardiologist at Massachusetts General Hospital, Dr. Richard Lieberson, who was premier in finding a treatment for congenital heart disease. I'm trying to get this phone to quiet down. With that, she was able to be cared for at Mass General Hospital under Dr. Libertson's oversight, where we learned from him that she was one of the very early patients to have this open heart procedure. Fast forwarding to about 4 years ago, my wife was informed that she had to have major heart reconstructive surgery as a repair from her early childhood procedures. And that was a defining moment in our lives. Fortunately for us, Dr. McGillivray, sitting to your left, was at Massachusetts General Hospital at the time. And Dr. McGillivray was very kind to explain to us what this surgery was going to be all about. She went through the procedure, a very long procedure, and did very well coming out of cardiac rehabilitation. Well, over the next 3 years following that operation, she had other surgical procedures unrelated to her heart condition that led to a time about a year and a half ago where she had to have knee surgery. And the anesthesiologist was sitting with me, prepping her for the procedure, remarking about her heart condition and the condition that she was in and how well she was doing for someone who had had tetralogy of Fallot back in the late 1950s. And he walked over to me and said that I should write a book about her case. Well, at the time, I said, I don't think I can write a book that fast, but my wife and I then sat down and thought about what would we be passionate about, and thought about and really reflected upon our own personal experience, finding that cardiologists in general did not know what to do with her and did not know how to care for her particular condition. And so we recognized that there was a need and decided to establish Heartfelt Dreams Foundation with the mission to provide emotional, educational, and financial assistance to patients born with congenital heart defects, their families, as well as the doctors and nurses who care for those patients. And so our foundation has a twofold mission. One is to assist patients in understanding that this is a lifelong condition and that they need to find specialized care, and we provide them with that kind of support. And the second aspect of our foundation's mission is to support doctors and nurses, the cardiologists that are treating these patients, and recognizing that there are a dozen or so specialized heart centers around the country, but there are many more cardiologists who don't necessarily have the familiarity with this particular condition to be able to treat these patients. And as medical care has improved over the decades, there are many more of these patients now living as adults, but not necessarily knowing how to obtain appropriate treatment and care for their lifelong condition. And so that's the other aspect of our foundation's mission, is to work with doctors like yourself and Houston Methodist to bring patients to you and recognize that they can be receiving appropriate care and treatment at the specialized heart center. And so that's what we're all about. And we've been working very hard over the last couple of years to bring this mission to fruition.
Well, that's one truly, truly incredible story that in many ways actually is very similar to some of the other stories that we hear oftentimes about our patients. So before we move on, I want to give Dr. McGillivray a chance to tell you all how you can connect with us if you're interested in asking questions or making comments. Dr. McGillivray.
Yeah, so we want this session to be interactive, and we'd like to have as many of those of you who are watching at home to be able to ask questions or to make comments. And to do that, you can join by web. That's through polev.com, and then once on polev.com, you can enter DEBAKEY, DEBAKEY, and then just respond to the activity after that. Or you can join by text. If you text DEBAKEY, DEBAKEY, to 37607, then you can text in your messages after that. We look forward to all of your comments and questions.
Great, thanks, Tom. So let's go on to Joe. So Joe, tell us about your story. So tell us how you got into congenital heart disease to begin with, and how you really decided that you wanted to support the community.
Yeah, so I'm a tetralogy patient as well, but I think my story is a little bit less maybe about myself. My parents, my father was a physician, he's an OBGYN, and I often say that I wonder when he first knew that I had tetralogy. I was undiagnosed in the womb, and I was extremely cyanotic when I was born. And my mom always tells a story about, the pediatrician coming in and telling her first, that I had a heart condition. Of course, I didn't know what it was at the time, and that they were transporting me. I was born in Northern California, and they were transporting me to UCSF at the time, which at that time was, if you were going to be on the West Coast, was the place to go. So I was 10 hours old when I got transported, but at that time my dad had already delivered a few thousand babies, and I'm sure he knew when I was born, and probably didn't say anything to my mother. But so I had a little bit different childhood growing up from that perspective. But my dad was one of my strongest advocates, and I had a little different perspective on medicine. I remember my dad drawing me anatomy when I was a kid, and I kind of started learning that. And I had a transannular patch placed at 2 days old in 1982, which the surgeon, Dr. Kevin Turley at UCSF, said it was the first transannular patch he placed in a neonate at that time. So, wow. And then at 9 months old, I had an aneurysm form in that patch, and it was my dad who convinced him to do surgery before he went on a fishing trip, and he came out of surgery and said if he would have waited till he came back on that fishing trip, it would have blown. Wow. So, you know, and it was my parents who noticed that I was going downhill because I just had a clear cardiac checkup a few weeks before that. But when I had my VSD closure at 6 months old or 6 years old, my prognosis wasn't very good. I was having a lot of rhythm problems. And, you know, my cardiologist always said, these are the kids that don't wake up one day. And when I came out of surgery, my rhythm issues were fixed, were fine, you know. And so, but beforehand, my mother made an ultimatum with God. She said, if you save my boy, I'll take care of your children. And so a few months after my 6th open heart surgery, we started doing foster care. My parents got licensed for six kids in their home. And so by the time I was 10 years old, so 4 years after that, we were taking in kids straight out of the ICU at Stanford and UCSF into our home, and extremely sick children. And of course, my mother started adopting them. And so that's when I started learning to take care of these kids. And so, you know, my father being the physician, my mother now taking care of them. And now, you know, I'm not only being the patient, but I'm learning that, you know, these children are fragile and all these, you know, being the caretaker, but also being in the role of being the one taking care of, you know, it was a unique role for myself. And so it was kind of the full circle picture of like life, right? And so for me, it was very unique. And by the time I was going off to college, my mom had, I shouldn't say my mom, my family, we had 120 foster children come through our home.
Wow. Whoa. That's incredible.
And my mom was thinking about, you know, okay, this is time to kind of slow down. And my dad's 40 years older than me, so they're older, you know. And she got a call from Stanford, had a tetralogy baby with MAPCAS, and she said, "This is the call I've always been waiting for." And so they warned her that, you know, this is kind of comfort care thing. She was very sick, but, you know, my mom was like, "No, we're taking this baby." And so they took her, and they were trying to expedite her adoption, and you know, she was extremely sick, you know, but she was Dr. Hanley's patient. I mean, you know, 20 years ago almost, if you're going to be anywhere, even today, if you're going to be anywhere, that's a place to be, you know. But that was in the infancy of what he's now built into the best program there is for that, if you know. And I remember, you know, Thanksgiving, my father resuscitated her on the dining room table. I mean, it's just like, and she was going into surgery with Hanley, and she arrested again, and they couldn't bring her back. And for me, it was like, it was the first time I realized, like, these kids are dying from this stuff. And for me, it was like, well, she has tetralogy with MAPCAS. Yeah, and back then I didn't, you know, now I know a lot more than I knew then, but there's tetralogy, like, they hit close to home for me. So it's like, okay, wow, that's like a big deal, you know. And so it started, you know, and then that was a time in my life, you know, a lot of congenital heart patients, you know, in their 20s, you start feeling you you get off that teenage high and feeling good, and you start going downhill. You start having some issues, your pulmonary valve starts failing if you have a tetralogy patient, and those little things start creeping up, and that's how I was feeling, and so it's like, okay, you're not feeling as well, and then that happens, and you're like, whoa, what's going on? And so, the emotional side of it was kicking in as long as with the physical stuff, and so it was difficult, But life kind of goes on, and then, you start trying to find a career and do these kinds of things and whatever, and nothing ever came to fruition. Like, I would do something I'd be real excited about. This is what I'm passionate about. Go into something that I was a hobby that I loved and turn it into a career. And it was just, what did my parents ever teach me? Turn something that the way they lived their life, and it was like, this is what I'm supposed to do, So it's like turning my passion of helping people along with what I know about my life and my history of my own personal experiences and what they taught me about taking care of these kids and all this stuff and putting it into a profession. And so that's when I went out and became in the first cohort to become a board certified patient advocate and actually turn it into make it a professional, take it to that professional level and say, okay, how can we help these people, take it to that next level and really, like, I call it elevating expectations. How can we elevate the expectations of everybody in the room? Can we expect more of the patients when they go see their doctors? Can we ask the doctors to expect more of their patients? Can we ask the patients to expect more of their doctors? Can we ask the patients to expect more of the organizations? As organizations, can we expect more of ourselves? And that starts with us. And I think for all of us, and that's what I love about you guys and everybody we work with, like, we have to put the patients before the institutions. We have to put the patients before the organizations, and if we don't do that, and if that's not the first thing we do in our decisions, then we're failing. And so it's like, I think that we have to always lead with that. And I think every healthcare organization starts with that, but I don't think they always continue with that. And so for us, that's what we're always trying to do. And I think for me, it all finally came full circle once I figured it all out. And it took a while, but now that it's here, it's like there's no doubt this is where we're supposed to be.
Well, thank you for that. I want to mention that one of your teammates, actually Lindsay Alano, has a shout out for us, and she's watching with us.
All right.
So that she's also one of the patient advocates with Team Uncle Joe. So Anna, you are a very familiar face in the internet world regarding congenital heart disease. Tell us your story and how you got into this and what your mission is now.
Well, just like Eric, I got into it because of a loved one. In my case, it was my son. He was born 26 years ago and was diagnosed with hypoplastic left heart syndrome. And I just kind of felt like everybody else. It's so interesting. When you have a good survival story, what you want to do is give back. You find that you feel so blessed that things have worked out successfully that you just want to turn around and give some encouragement and hope to others. And Alexander definitely did that for me. He's my inspiration and why I do what I do. But I'm an extreme introvert. Most people don't believe that when I tell them that. But Alexander has made me come out of my shell. First, though, I started by writing, which you can do as an introvert, and it's not a problem. But then the thing is, once you publish your book, people want you to talk about it. So you can't stay introverted very long, can you, Eric? So I started talking about it and realized I needed Toastmasters, and Toastmasters really helped to bring me out of my shell even more and to learn that it's okay for me to be an introvert and yet still to spread my message and stories of hope. And through that, I built a web page and people started to find out more about me and about my books. Then I started speaking on radio shows and on television and just little small interviews, not huge things. Although I did do a whole hour-long presentation with NPR when I was living in Florida when my last book came out, which was very exciting. But then somebody called me out of the blue 7 years ago and said, have you ever thought of having your own talk show? That was not something I had ever thought about doing. And so they said, well, you know, you really should have your own radio show. And that's when Heart to Heart with Anna was born. So my nonprofit organization was already working on providing resources and information via the internet, mostly through our website. We had a page called congenitalheartdefects.com, which we still have, which has over 100 pages of free information for the congenital heart defect community. But then I started putting together a podcast. Now, this is how old I am, Dr. Lin. I didn't know it was a podcast because 7 years ago they didn't call it a podcast. We called it an internet radio show. And I started interviewing people from all different aspects of the congenital heart defect community, including great doctors like Dr. Lin and patients like Joe, and even spouses like you, Eric. So I've been very blessed to have met people from all across the spectrum, from all over the world. And I've done it for 7 years. 11, 12, 13 was when my first episode aired. So it's a really easy date for me to remember. So I'm coming upon my 7th anniversary of being a podcaster. And now I know I'm a podcaster. It's not, it is an internet radio show, but really now we call it a podcast.
Well, that's wonderful. So, so maybe you can tell us a little bit about some of your passions about the podcast and some of the topics that you felt have been really, really powerful, and that you've kind of had a burden for to really get out there.
Wow, I've done 287 episodes,
Wow.
So it's hard to pick favorites. I used to do it by themes. So each season had a different theme. And then it was recommended to me, and I like to listen to my listeners, so please do keep communicating with me. They said, well, but when you start upon a theme that I'm not interested in, I don't listen for weeks and weeks at a time. So now I don't have a theme, and I'll talk about any given topic at any given time. But one theme for one season was all on advancements in pediatric cardiology and congenital heart disease. And that was amazing. I had fabulous doctors. Dr. Edward Beauvais from Ann Arbor came on, and Dr. Ami Bhatt has been on my show. I twisted Dr. Lin's arm and finally got him on my program. And Dr. William Novick, who is now on my medical advisory board, as is Dr. Lin. So I've had some amazing people come on my program and share advancements. To me, that's always interesting. I want to know what's next. So if something happens to Alexander, I don't have to ask, is there something available? I'll already know where it's available and what is available. But I'm not a doctor. I'm just a mom. So I have to have it explained in information. All of the information has to be explained in ways that people who are not medical can still understand it. And so I love having the doctors on the show and the nurses. We have some fabulous nurses out there who have come on and talked about the history of pediatric cardiology. To me, that's always interesting. I love history. So those have been some of my favorite shows, but also the ones that pull at your heartstrings. I love hearing from the grandparents and the parents who have children who are much older than my son. You know, people like Eric's wife. They're the pioneers. They're the ones who give me hope that Alexander will grow to make me a grandmother.
That's really incredible. I think one of the things that you mentioned that I think has been really something that's been a passion for us as well is really getting patients and their family members familiar with some of the technologies and devices and advancements. Not only the new ones, but also the old ones that have really revolutionized the way we take care of patients. And so Dr. McGillivray and I, during this extraordinary time, put together a video for tomorrow, a series of videos tomorrow for the symposium, in which we're actually going to be talking about many of the cardiovascular devices. So for those of you who don't know, we're actually having our Adult Congenital Heart Symposium virtual tomorrow. It starts at 8 a.m., so you can tune in through DEBAKEY CV education as well. But specifically, if you're interested in learning about valves and pacemakers and other types of technology, you can join us specifically at 12:45, and we're going to actually have a panel including team Uncle Joe, as well as
Yeah.
some other advocates who are going to be helping us to ask some of the questions that you may not dare to ask. So I want to make that quick plug to your point, Anna. But the other thing that I really sort of have been struck by is really these stories of incredibly dire situations and unmet needs. Eric, yesterday when you and I were just chatting, we talked a lot about some of the things that you've encountered since starting your foundation, where just some of the things we take for granted that as physicians, patients should be able to do on their own. Can you tell us a little bit about what you guys have been doing to meet some of those incredible needs that we never expected would be a problem?
Well, I would be happy to. And certainly over the last several months, the challenges have become very apparent. Certainly with the pandemic, we've had patients fearful of going to the hospital, not because of their condition, but because of the virus. And so as we've been addressing those issues, we've had patients that are just afraid to address their condition. Either they were diagnosed into adulthood and they didn't realize it's a lifelong condition, or they're just afraid of the surgery that is impending. And so we've had experiences of patients that were misdiagnosed, for example. One that just breaks my heart is a 30-year-old woman who was not feeling well. The doctor performed a hysterectomy on the patient. She still was not feeling well. The patient was then brought in and had a pacemaker put in, still was not feeling well, and was referred to a specialized heart center where she was diagnosed as in need of a pulmonary valve replacement. Had that surgery and now is doing terrific and is doing very well. And so we've heard stories like that, and we've talked to patients about their fears and their anxiety and trying to convince patients that the doctors at the hospital have been trying to get to come in for a year or two. And through the communications from our foundation, we've been able to allay some of those fears and lower the stress level, then provide them with the transportation or other services to get them to the hospital so that they can receive the proper testing, the proper evaluations, and then ultimately the surgery that they need. And so we experience patients that have fear. We've had some patients tell us that the financial support that's being offered is not for them, it must be for some other patient. And then we have the other end of the spectrum where the patient just doesn't have the way or the means to travel to the hospital from a distance of an hour drive to a 6-hour journey. And we tried to help them through that process because we also hear from the doctor that there's a real need for this patient to come in and be seen. And so it has been an interesting experience prior to the pandemic, addressing the concerns. We have seen the advent and advancement of telemedicine because of the pandemic, and those like Dr. Bott that Anna mentioned, who have been promoting telemedicine for some time now. It's really coming to fruition because of the need for these virtual visits. And we've just recently been working with a patient who indicated that he was referred to a specialized heart center after having 2 prior surgeries at a different hospital. The surgeries were not successful, and he was not willing to go into the specialized heart center for his 3rd procedure because he didn't want to be there in person without his family. And his family wasn't going to be permitted in because of the pandemic. And so a telemedicine evaluation was set up for him, and he was able to sit there with his children at his arms to be reassured that his care would be appropriate and the treatment would be provided appropriately. And that allowed him the confidence to make the decision to go to the hospital and have the surgery that was importantly needed. And so we've been experiencing those types of patients in the last several months and hope to continue that process, as I'm sure Joe and Anna have seen that same type of patient, as have you, Dr. Lin, at Houston Methodist. And so we're hoping that with the pandemic moving on, that patients' fear of going to the hospital will come down and they will seek the treatment that they need in order to keep a quality of life that is important for them.
Well, thanks for telling us about that. I think it goes without saying that these are just the nuts and bolts of care that we, like I said, physicians take for granted.
I think that goes to an important point that the adult congenital heart patients have access to care in a lot of areas that is difficult because the care can be very far away. And, you know, COVID only increases that when you start adding in, how do I get there? Who's going to go with me? Who's going to be at the hospital with me? Do I even want to go? And so when you look at that, you know, it's already difficult to get there, and then add in those other layers, it just makes it that much harder. And so that burden is just increased. And so are they actually going to go get the care they need? And I think a lot of them probably aren't.
Yeah, absolutely. And I think that's why it's so incredible that we have advocates like you, Joe, and then the Heartfelt Dreams Foundation that can help. I guess, Tom, it seems like almost a miracle that there's a foundation like Heartfelt Dreams that can support our patients that way. I mean, I guess maybe you can tell us some of your experiences of where just things have fallen apart just because of things we take for granted.
Well, you know, as I listen to everybody's story so far, I mean, there are a few things that are common themes. One is congenital heart disease doesn't just impact the patient, and it impacts an entire family. And it's an impact that lasts for the life of the whole family. And that listening to Eric again with the story and Joe's story, that certainly early on, the families were very much like the early explorers. It's as if they were getting in a ship and going out to sea, and they didn't know where they were going to end up. And really nobody could give them guidance as to where they were going to end up. I remember when I was back in Boston taking care of one of the earliest patients that was cared for by Dr. Gross and the doctors at Boston Children's. And when it was time for the child to go home, they asked Dr. Gross, you know, what's next? And his response was, we don't know. You know, we think this is going to be helpful, but we're just going to have to see. And I think, you know, as a parent, thinking about what that must have meant to parents taking home a child with congenital heart disease. And I do think that certainly over the last 65 years, we've learned a lot, but I don't think that feeling really ever goes away to patients, families, and to their parents when they have a child that is sick. And that to have the support of people who have gone through it is invaluable. I mean, we can talk to the patients and we can talk to their families, and I think they can appropriately say, well, I don't think you truly understand how we feel. Those patients can talk with all of you, and you know exactly how they feel, and you can guide them, and you can let them know what the waters are going to be like. You can tell them where the winds are going to take them. And I can't, and in my experience, for patients and their families who are approaching surgery or an intervention with trepidation, the best thing is to ask a patient who's been through it, or a family who has been through it, to go and sit at the bedside or pick up their phone and make a phone call and talk the family through it. And it's the best medicine that we have, I think.
That's great. That's the point that I wanted to turn over to Joe. So Joe, so we know that that's important, but we actually don't know what part is important, right? We know it's so important to have another patient who's been through it be the guide. Where are the elements that you often see are so powerful when you can step into a room and talk to a patient about your journey? where do you see them sort of connect and suddenly feel this sigh of relief and feel reassurance and confidence to move forward?
Oh boy. I think it's finding that that's one string of commonality, and it's with every case and every patient, it's something different. And there's no one thing. You have to, and that's where I find that there's what I do, what I'm trying to do, and what we do is there's not this off-the-shelf solution. It just doesn't work, because you have to go into each situation and say what's going on, and then pull back into your history, whether it's mine or something else I've dealt with somebody else, and say, I've seen this before. How can I correlate it, and how can I bring their level down just a notch and make them feel like this is somewhat okay, or maybe this isn't okay, but this is how we've dealt with it in this past, and here's our way out of this. Okay, we're gonna do X, Y, and Z, and here's our path forward, and let's go get it. And as long as we have a path forward and we're moving forward, we feel like we're doing something. But if we're just sitting here, we aren't doing anything. And so we have to have a plan. And you just have to find that. You just have to find the commonality. And the more experiences we have, I have, or our team has, the more we can put those pieces together and say, this is our way out of this. You know? And for everybody, it's different. And maybe it's not one story or one experience. Maybe it's multiple stories and experiences that you're putting those pieces together and coming up with that. But just to say, oh, this is, they're putting A and B together, off the shelf, it just doesn't work. And I think, as a surgeon, it's sort of the same kind of thing. You kind of have to think on the fly. You kind of have to go with the situation and put all your experience together to come up with what's going to work in these situations, especially with congenital heart disease. That's just how it is. And so, it's a think on your feet, and you have to really dig. A lot of times it's, dig into their situation and get to know them enough. Sometimes they want to answer right away, and it's like, hold on, let's talk about this. What happened? This happened. This happened. This happened, and keep digging into their history. Read some more records. Okay, this was what happened before. Go back, dig back, get some more answers, understand things, and then kind of come up with a solution.
That's really great. I think one of the things that oftentimes we run into is just a pure fear. I think especially for our patients like yourself who have undergone many surgeries in childhood, and they have a lot of trauma underlying their experience. I think, hearing you're doing just fine early on in sort of late childhood or their teenage years has sort of prompted a lot of our patients, before they even become our patients, to sort of avoid seeing doctors and feel like they don't actually need to see doctors. So I guess when we step back and think about that, and this is a question for all of you guys, how do we break that barrier? How do we help patients to get past that fear, get past that trauma, and get back into care? Joe, we'll start with you.
Yeah, I think the "you're doing fine" thing is a bad. I hear it from a lot of patients. They say, I'm doing fine. Well, you're doing fine for who? Because if you walked into an ER as this patient and they didn't know your history, they wouldn't say you're doing fine. So it's all relative, right? And so they have this kind of warped view. I was talking to a hypoplast patient the other day who said that they keep telling me I'm doing fine. And he says, I see all these other patients, like these tetralogy patients, and they're having all these surgeries and stuff in their he was a mid-20s, mid-30s, or mid-20s. And he says, I see all these other patients and they're having all these surgeries and or interventions and things, but they keep telling me I'm doing fine and I'm a hypoplast, and what's the situation? It's like, well, yeah, you're doing fine. It's relative, and what there is, the solution for you there's not an intervention typically for that. Like, but you're fine. I mean, not to run out there and think that there's something wrong, but it's a different perspective, but they don't communicate that in an effective way.
Yeah.
He thinks, you know what I mean, to say that you're fine, and so it's like you're fine, and then it's all going to come crashing down, right? And we know it's all going to come crashing down, and so you have to set the expectations, and that's the difficult part. And I don't think that the expectations are set. These expectations were never set for me, and granted, I mean, we know that. Before we thought pulmonary insufficiency was not a big deal, and now we know it's not. So history's changed. Even in the course of my lifetime, it changed drastically, right? So that's not blaming anybody, but I never knew I was going to need another surgery or anything. And then even just probably in my 20s is when the data started showing that, oh no, this isn't me. I have free PI most of my 20s. When I was going to do something about it, right? Okay, but. So if you go most of your life not thinking anything needs to be done, you're okay. Oh crap, you're having VT, you need to have surgery next week. It's like, and it's a tough way to live.
Yeah.
And you talk about the trauma. I had a defib vest for 9 months before my next surgery. I was in the hospital for 2 weeks emergently. I mean, whatever. I wasn't like dying, but it still was not like a fun experience, like get back to the hospital now, like kind of thing when you think you're doing okay to that, nobody telling you you're going to need surgery the rest of your life to the whole thing coming down. And so I get it when they say you're fine and then you're not.
Yeah.
So I think it's setting expectations and saying you're doing okay for you. But things are probably going to change at some point.
Yeah.
Joe, you make so many excellent points, and that a couple of them are, you don't have to really be dying to fear that you are dying, and I think that certainly as children, there are so many things that back in the old days that were so painful and fearful and unknown that it is hard to shake that. Even as you get older and you become an adult, and even if they were doing things to help me, boy, at the time it seemed that they were doing things that were hurting me. The other thing is, I don't think there's a specialty in medicine that has advanced so much that congenital heart disease has. If you think about it, I say this over and over again. Queen Elizabeth has been Queen of England longer than we've been doing open heart surgery. And that if you take a look at kids that were born before Queen Elizabeth was queen with even moderately severe congenital heart disease, they didn't live, not only to adulthood, but to late childhood. And we have learned so much, and we've been able to do so much since then. And it keeps changing, it keeps getting better. One of my mentors back in Boston was a great scientist, a great surgeon, and a great person. His name was Dr. Judah Folkman, and he was a wonderful guy. And whenever he was not a heart surgeon, he was a pediatric surgeon. And whenever a child and a family would come in that had at that time an incurable problem, he'd say, hey, come with me. And they'd walk down the hall and they'd look out the window to the research lab. And he'd say, right now, there are teams of researchers working on your problem right now. He said, we may not have a cure today or tomorrow, but we're going to get one. And you just hold on until then. And you take a look at what for your wife, your son, you, Joe, that what was available back then and what we have today, and more importantly, what we're going to have tomorrow. So things that we feared, all of us, are going to be, that is the energy that will propel us to solve the problems that we have. So you just wait, you just hold on, because we have more to come.
Yeah, and I want to add to that, of course, that Joe, Anna, Eric. It's not just us, it's not just the researchers, it's also this community.
Absolutely.
You guys who are giving so selflessly to support patients, families around you with all the work that you do, really make it actually possible, I think. I've just been inspired in the last several weeks just talking to all of you and some of our other colleagues as well, and just hearing about all the amazing stories that you have. So I guess my next question then for all of you is, when you look at what you do and where the needs are, where do you think we need to go? So specifically from your own experience, Anna, you do a lot of education through the podcast, and a lot of cutting edge education, things that people don't necessarily think about when they're thinking about how to educate patients and families, and of course physicians too. What do we need to do next? What are sort of the pain points that we have to address as a community? And where would you like to see things go?
Wow, $1 million question.
Yeah. $1 billion question, maybe even.
Yeah.
Probably, yeah. I want to back up just a tad because I want to talk to what Joe just talked about a little bit, because you were also asking about how do we get people to not fall out of care. And I think that's the $1 trillion question. Oh my gosh, how do we prevent that? I just finished having a meeting earlier today with Global Arch, which is a community, an alliance of organizations for the congenital heart defect community. And it's astounding the number of people who fall out of care by the age of 5. And so how do we keep people in care so that they will tune into my podcast, so they will come back and see you and have those surgeries and continue to live a long and productive life? I think what Joe was saying about setting the expectation, I think that's so important from a very early point, as soon as the heart defect is diagnosed. However, being the parent of a child with a heart defect, I can tell you I'm always waiting for that other shoe to drop. And it does cause anxiety, it does cause fear. And so because of that, a lot of people are afraid to go back because, hey, my kid's doing great. They're running around, they're playing, they're keeping up with their peers or their siblings. They don't want to be told something different. They don't want to be told, oh, that pulmonary valve is going to start having problems and you'll be back in 6 months for another open heart surgery. It's scary. I think a lot of the adults, for the first time in their lives, may be feeling well. They don't want to go back every 6 months or every year, only to be told that, hey, you're not doing as well as you think you are. I'm having that struggle with my son. Here I am, a podcaster, putting out shows every single week. I talk to my son about what I'm doing. I'm always trying to keep him educated. And he hasn't seen his cardiologist as recently as I would have liked. In fact, his cardiologist retired. And he needs a new cardiologist. How do I get him to go back? He feels great right now. He puts in 10,000 steps a day because he's a pharmacy tech and walks medications all over the hospital. Wow. How do I convince him that he needs to go back and see a cardiologist when he feels great and can probably walk, circles around me? I don't know. I will tell you, since the time Alex was little, he's heard me practicing speeches. He's seen me writing books. He knows his heart condition is a lifelong condition. How do I get him to make that appointment? I can't make it for him anymore. At least I know he has access to the resources, but what about these families or these young adults who don't have a job that has insurance? This is a real issue. This is something that we're facing on a global perspective. And I don't think there's an easy answer. It's just like Joe was saying, there's no one-size-fits-all answer. It's really going to be up to all of us as a community to come together and to talk about it. For a long time, I didn't even know somebody else who had a child with a heart defect, unless I went to the hospital. Now it seems like every time I turn around, I'm running into people who will say, oh yeah, my cousin has a heart defect or my brother has a heart defect. It's amazing as soon as I start talking about it. In fact, just a couple weeks ago, I gave a speech to my board president's Lions Club. And by the time I was done with my speech, 3 people raised their hand and told me about relatives they had who had congenital heart defects. It's astounding. we need to keep talking about. The more we talk about it, the more awareness we put on it, the better chances we're going to have of people who won't fall out of care. It's not going to be fast. It's not going to be easy. But we are on the ground floor of making it happen. And what you're doing with this live show, this is awesome. People can call in or they can send you questions. How many people are afraid to ask their doctor, or they have that hour-long visit with the doctor and on the car ride home, they say, why didn't I ask this or why didn't I ask that? This is great. This forum is a great way for us to open those lines of communication and hopefully get people back into care who have fallen out.
We have a great question that has just come in, and I'll read it. It says, in regards to trauma with congenital heart disease patients, do you feel a visit with a social worker during an annual cardiology appointment would be beneficial? What do you think? Joe?
I think that maybe a psychologist or a psychiatrist. I think so. I think this is the number one unaddressed issue in congenital heart disease. Is actually, we know the neurocognitive issues. They're researched. They're well documented. You know, Dr. Bradley Marino is the champion of this, but we don't address it. There is no solution. And the trauma. I mean, we don't have the specifics to address it, and we need to have. I mean, social work would be great too, but we need to have those resources that are specific to the congenital heart community. Why isn't this there? The psychologists and the psychiatrists that know these issues and know how to help this community put the scaffolding in place to address them.
Yeah, that's a great response. Eric, if I can pick on you for a little bit, I mean, I guess as a spouse, I mean, I'm sure you have to be right there and hear about this often. What are your thoughts from that standpoint?
Well, I certainly appreciate and agree with Anna's comments and Joe's comments. I think it's information and education, and I think, as the spouse of a congenital heart defect patient, I've learned a lot, and that was part of my objective, was to better understand what's going on. And when I was first told by my wife that she was born with tetralogy of Fallot, first of all, I couldn't spell it, and secondly, I didn't have an internet to look it up. And so I had to get a book out and read a little bit about it, and I've learned so much over the years. I think that the fear and anxiety is a real issue with patients like this, and I think in our case, from a personal standpoint, it was more a feeling of frustration. I don't think my wife ever thought that this was a problem or an issue that was going to go away. It was that she had questions that weren't being answered. And I don't think it was out of lack of interest, it was just lack of knowledge. And so it wasn't until we were connected with a doctor and a cardiologist that knew about this condition that he felt more comfortable about moving forward. And I listened to what Dr. McGilvery just shared about the advancements in medical technology, and having worked in that profession for 30 years, I agree with that. And we were actually told by her cardiologist that she was going to need major heart reconstructive surgery at some point, and it was going to be a race with her chronological age versus advancement in medical technology, with the hope that medical technology would go faster so that the procedure would become either less invasive or more safe or more effective or something. And in her case, unfortunately, her age caught up, and we were told that it's now time. Yeah. And so I think that while medical technology has advanced dramatically, and I think about what I have read about open heart surgery before the heart-lung machines, it's scary. And so what has happened in the decades since is fantastic. And so the procedures are much better, and doctors know what to do, and surgeries are successful. And I just, again, look at my own situation, and I will never forget a a conversation that I had with Dr. McGilvery after my wife had her surgery, and it went well, and she was doing fine, and things have only gone well since. And I agree with Anna's comments. Right now, my wife could probably outwalk me. And so I think it's a message of hope, of inspiration, of sharing information and education. I can recount very quickly one story about the very first patient that our foundation supported. We were 2 weeks into our foundation's activity. We didn't have a website. We didn't have a Facebook page. I was answering a phone, and I didn't know who was calling, and we found out about an infant born with a congenital heart defect, and the family was devastated. They didn't know what to do, and they were, in fact, in their case, traveling 200 miles back and forth between two hospitals trying to get an answer. And they were terrified of the situation. It was their third child, and they didn't know what to do. And we had several conversations with them over the phone to relate the experience that we had. Well, that patient is now 2 years old and doing fine. Had surgery, is doing great, has other issues going on, but when I last communicated with the patient's father, this little boy, his father told me that he's a fighter and that he's working through these issues. And so it's that kind of message, I think, that as we all try in our own ways to share that experience, hopefully that will break down any barriers of trying to get patients back to see their doctor. And I can certainly appreciate what Anna's going through with her son, because they feel fine until they don't. And unfortunately, we've experienced patients that have told us that. Just 2 months ago, I felt great. And the next thing I know, I get a call and they're in the emergency room and we're trying to help them get to the hospital. And so I think this information sharing and the programs that you, Dr. Lin, are doing at Houston Methodist and the DEBAKEY Heart Center is just phenomenal. It's so important.
Well, and then I want to reflect that by saying thank you to all of you, Eric, Anna, and Joe, for just giving so incredibly selflessly and so compassionately to these patients and these families that really have needed your help in a way that I think most of us wouldn't even have recognized that they need your help. So I just want to tell you that personally that you've been incredibly inspiring to all of us. And I hope anybody who's watching now is also being inspired. If you just joined us, we're closing at this point in time, but you can come back anytime and watch this on our YouTube channel. And I hope that all of you will continue to join us as we talk about more of these inspiring stories from patients and family members and community members. And I hope that all of you will feel the inspiration to become part of this community and to help to serve this community just like Eric, Anna, and Joe have. Thanks, Dr. McGilvery, for joining us. Thank you, Joe.
Thanks for having me.
Anna and Eric. I think this has been a wonderful show. And as always, we are all on social media. Please connect with us if you have any questions or thoughts or comments. And as I mentioned at the top of the show, we're going to continue doing this on a monthly basis. So join us once a month. If you want to come talk to us about a show and you want to be on our show, let us know. We'd love to have you. Join us tomorrow for our symposium. And if you're interested in finding out what we've been doing all this week for Houston Methodist Congenital Heart Awareness Week, you can also join us on our YouTube channel and see what we've been doing. Thanks for joining us today.
The Adult Congenital Heart Symposium is a forum for patients and providers to come together to learn about the newest developments in adult congenital heart disease, to establish a sense of community. I think coming to this is being a part of developing the next steps in the care of this growing group of patients.